Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. This 10-and-a-half-year-old male entire Labrador Retriever presents for vehicular trauma about 45 minutes prior to presentation. A witness identified that his back end was struck by a car. Let's take a look at the radiographs. Within the abdomen, we observe that there is reduced serosal contrast with fat stranding noted along the falciform region. There is focal and marked loss of serosal contrast in the caudo-ventral abdomen. Where there is reduced serosal contrast, it means that the juxtaposition of peritoneal fat with the viscera is altered by increased soft tissue in the peritoneal space. Generically, this can mean that there's peritoneal effusion or inflamed or edematous fat. Additionally, we see loss of serosal contrast with fat stranding in the retroperitoneal space, where there is also loss of distinction of the caudal margins of the renal silhouettes. Let's take a closer look in the caudal abdomen. We observe a round soft tissue structure that may represent the urinary bladder. It is only partially defined by immediate juxtaposition of fat opacity. Caudal to this, near the pelvic inlet, is another vague soft tissue opacity. This could represent the prostate given the patient's advanced age and intact status. Throughout the region between these two soft tissue structures, there is poor distinction of a possible urethra. Given the marked loss of serosal contrast in this area, retroperitoneal effusion, and recent trauma, we have to consider the potential or possibility for compromise of the lower urinary tract, such as urethral or ureteral rupture. Let's start to look at the musculoskeletal structures. We see an oblique fracture of the right ileal body that is functionally shortened on the ventrodorsal view. This is consistent with cranial displacement of the caudal fragment, resulting in foreshortening of the ileal body. Another fracture bisects the right acetabulum. This creates a segmental component of that right ileal body and cranial acetabulum. Overall, these components are axially displaced, resulting in narrowing of the pelvic canal. The left femoral head is both cranially and dorsally displaced. The margins of the acetabulum and of the femoral head are smooth. In this case of trauma, we've identified peritoneal and retroperitoneal effusion with loss of the boundaries of the lower urinary tract. Heightening our suspicion for rupture, this can be characterized further with a positive contrast cystourethrogram. We also have identified pelvic polytrauma evidenced by the disruption of the right load-bearing axis, the ileal body and acetabular fractures, and the left load-bearing axis, the left coxal luxation. This can account for the patient's inability to rise. The axial displacement of the right hemipelvis should be considered with great care, as fragments can compromise the rectal wall or the intrapelvic segment of the urethra. Be sure to check out the entire report associated with this case, and thank you for listening. Remember, it's your case, so please post your questions on social media.